Welcome to Norwalk Hospital and Nuvance Healthcare's section on prostate cancer basics. I'd like to take this opportunity to thank you for listening, and I'd like to reach out to my colleague and good friend, Dr. Mario Pinto, who works in internal medicine in Westport at one of our local facilities. Mario, thank you very much for joining us.
Oh, thank you, Dr. Shasha. I really appreciate you having me in this meeting, and I would love to discuss prostate cancer with you and with our audience.
We are very grateful. I'd like to start by introducing myself. I am Dr. Daniel Shasha, Chief of Radiation Oncology at Norwalk Hospital and attending physician in the Department of Radiation Oncology at Memorial Sloan Kettering Cancer Center. My own background is in prostate cancer, where I have specialized in management of that disease using all modalities of radiation therapy, including historically three-dimensional therapy that was followed by intensity modulated radiation therapy that some of you may know as IMRT, that later evolved into image guided radiation therapy, and most recently has included stereotactic body radiation therapy with prostate brachytherapy or seed implantation being used all along. So we'll go into those in a later section. Today, we would like to focus on the basics of prostate cancer, diagnostics, risk factors, screening, and prevention.
So my name is Mario Pinto. I am an internal medicine physician, and my specialty or my practice is primary care here at Internal Medicine Associates of Westport.
Mario, thank you for joining us. We're very happy to have you here. It's really a pleasure to get to work with primary care physician because your specialty is the front line of all medicine, and patients come to you with all sorts of problems. Prostate cancer is, I think the most common cancer, solid cancer in all men. It's the number one cancer. So patients often come to me, and I'm sure they come to you with the same question. I'm curious to hear what you tell them. What are the ways that patients can reduce the risk of developing prostate cancer? Is there anything they can do in lifestyle and environment? What are your thoughts on that?
Just to note that all men are at increased risk of prostate cancer. And again, age plays a role. Obviously, the older the person is, the greater the chance of getting prostate cancer. And we're also looking at, African American population and again, family history of prostate cancer. Unfortunately, we don't have like a primary prostate cancer prevention strategy. However, we do know that lifestyle choices could reduce the risk of developing many illnesses, including cancer, such as eating a healthy diet full of fruits and vegetables, regular exercise, and obviously decreasing smoking or try to avoid smoking.
That's brilliant. The saying that I always use with the patients when I see them, because they're always asking, why me? Why did this happen? And it's always, as you say, does anybody in your family have any kind of cancer, not just prostate cancer? We know that men, as they get older, are more likely to develop prostate cancer. The old saying, as the saying goes, if you're lucky enough to live long enough, you'll be unlucky enough to develop prostate cancer. It's virtually ubiquitous in all men of a certain age. But fortunately, while most men in their lifetime will develop it, few of them need to know of it, few of them do know of it, and very few actually will be mortally threatened by it. Another thing to consider is when you talk about prostate cancer prevention, and this is where primary care and I think specialty care is very much aligned. You're constantly telling your patients when they ask, what's a healthy diet? And you say low carbs, low fat, avoid trans fat, avoid smoking. Well, as it turns out, there's actually a good literature to suggest that a healthy heart diet, I think we all know what that is a healthy prostate diet. So what's good for your heart is good for your prostate. Avoid red meats, avoid fried foods, avoid high sugar bursts, all these trans fat. These are all good techniques for minimizing your risk, not just of prostate cancer, of also prostate problems, urinary problems. It's a good idea to watch your diet, maintain the healthy lifestyle, the basics, no smoking, minimal drinking, avoid the trans fats, the fried foods. These are good pieces of advice.